common for people dependent on drugs to relapse at least once before recovery, or sometimes severally before they finally get clean. My team today is versed on the topic relapse, and so I have in the house Dr. Montfort Olisa of the Federal Neuropsychiatric Hospital, Enugu. You are welcome to Drug Dangers.
Thank you, presenter.
I also have Dr. Chinawa Francis, a psychologist with the Federal Neuropsychiatric Hospital, also in Enugu. Sir, thanks for joining us.
Thank you, the presenter.
The program is Drug Dangers, showing on ETV channel 50. I am taking off with you, Dr. Olisa. What triggers relapse?
Yeah, thank you. A lot of factors that actually trigger of relapse. Then for simplicity purposes, we can classify them into three broad classes. The first class is the class that's associated with the drug, the nature of the drug itself. And the second class is the class that's associated with the characteristics of the drug addict. Then the third class is a class associated with factors, environmental factors associated with the drug addict. Now, for the factors that have to do with the drug itself, it depends on the chemical nature of the drug. So some drugs are associated with high rate of addiction. They are more addictive than others. You know, for instance, we have cocaine, we have methamphetamine. So, and why they are more addictive than others is because they result in increased levels of a chemical called dopamine. Dopamine is a pleasure hormone. So some drugs lead to release of more dopamine in the central nervous system. So whatever gives man pleasure, that is
tries
what
to go
yes.
at it again. Okay, so when we use relapse in terms of drugs, it has everything to do with most times the chemical content of the drug.
Yes.
And is that just all? I think Dr. Francis will take it up from here. Is it only the chemical content of the drug that can cause relapse?
Well, thank you very much. It's not only the chemical component. If you look at the adverse social effects, the environment where the individual is raised and staying could trigger relapse, because in the environment you can find some peer group influence, those people that always make him or her to indulge in substances, and more so the environment leads to craving, because at times when people indulge in relapse, more often the urge, the desire to continue to take the drugs simply because of the joy and also the pleasure they derive in taking the drugs, most often leads them to relapse.
Okay, and so back with you,
okay.
Dr. Montfort.
Okay, there are still other factors, like factors related to the drug addict. Now,
can we call them people who are dependent on drugs?
Yes, people who are dependent on, yes. So now, some people that have this drug addiction actually have co-occurring mental conditions, meaning that the mental condition is comorbid with the substance use disorder. For example, somebody that has depression, a clinical condition called depression, can have increased risk of relapse. If the person breaks down with depression, the person may have low mood, low energy, and if the person has been using these drugs before, he may believe that, oh, if he goes back to use of the drug may help in elevating his mood. So then again, people that have problems with stress, they are not able to handle stress. They use drugs as a kind of escape. Maybe somebody is angered, he's agitated, he doesn't know how to calm down himself, he wants to use the substance
as an escape.
As an escape.
Okay, so I think at this point it would be pertinent to talk to us about what relapse actually means. You've been talking about what triggers it and all of those. Well, what is relapse basically?
So relapse is one of the major components or major attributes of dependence. In fact, we cannot be talking about dependence if we're not talking about relapse.
Okay.
So relapse, means that the person is so dependent that he cannot do without the drug. Even if he stops, he wants to go back. So relapse simply means resumption of drug use after a period of abstinence. So somebody has maintained abstinence for a period of time, and something now happens again that triggers the person to use the drug, to resume using the drug, and to dependence level.
Now, does it just happen with someone who is undergoing rehabilitation, or someone who decides on his own to quit dependence or
Okay,
drug?
it can happen in either way. Somebody may decide, not necessarily, the person may not necessarily be in the hospital. Somebody may decide in his house, I want to stop using this drug, and the person has actually initiated, the non-use. Then after some time, maybe stressors come up, and the person is overwhelmed. The person starts using the drug again. Then even while the person is being rehabilitated, some coping mechanisms can also be broken down, and the person goes back into use of substances. So it can happen whether the person is under rehabilitation or whether the person is on his own and he has decided to stop using the drug.
And Dr. Francis, you're a clinical psychologist. Who relapses more, male or female, old or young?
Well, from statistics and from observational survey, the male relapse more and the adolescents relapse more because of some factors, inherent factors. And more so, when you talk of relapse, relapse simply means reoccurrence of a symptom, all right, with behavioral changes. When these symptoms reoccur, even when the individual must have been treated and discharged, and the symptoms reoccur within a very short period, by implication, it means the person has relapsed. Then for those people who are adolescents, because of the adolescent behavioral disposition, they always use drugs to determine their personality type. They'll tell you that when I use drug, I'll be able to thrive, I'll be able to achieve my ambitions, it will be able to make me forge on, even though it is being used as a negative factor. So that's actually what happens with relapse.
Oh, okay, Dr. Olisa, now, Dr. Francis said that male relapses more, adolescent relapses more. I'm clear on the case of the adolescent, peer pressure and all of those. But in the case of the male relapse, are there some mental reasons behind that?
Okay, there could be some biological reasons behind that. Now, we know that males have a hormone that we call testosterone. So testosterone is a hormone that is associated with, activity, pleasure seeking, wanting to experiment. So testosterone is an aggressive hormone. So that could be one of the reasons why males have more tendency of exploring even things that are associated with increased risk of bodily harm.
Okay, not just in the case of
yes, that could be one reason.
All right. Now, how long does one have to sleep during recovery to conclude that relapse has occurred?
Okay, there are actually controversies surrounding that, but some people believe that you cannot be talking about relapse if you've not stayed off the drugs for at least a minimum of 2 days. So, like if maybe I'm the one that is using a substance and I say, oh, I want to stop, and I start maintaining that abstinence, and maybe suddenly, even within a short period, maybe like 24 hours, I start using it, it means that I didn't really maintain abstinence. It's still the same pattern. So for you to say that somebody has relapsed, this person must have stayed a minimum of 2 days.
48 hours.
48 hours. And the person now starts using it, you can say that the person has relapsed. Or if it is less than that, it means that the person didn't actually...
Not stop
yes. Then again, there are some other qualifications to that. For substances like cigarettes, it's not just starting the drug. The person must have continued to use for a minimum of 7 days for cigarettes for you to say yes, the person has actually relapsed. So there are various operational definitions for it, but we can make do with this.
Now, this thing, does it happen gradually or spontaneously?
It can happen either way. In fact, that brings me to, there are 3 arbitrary categorizations for relapse. You have the first stage of relapse is the one they call lapse, or first sleep. The person just tests it, you know. So if somebody tests it and begins to feel remorseful that he doesn't want to continue, you can actually go back to the abstinence level. Then, but if the person now continues, there is a period called transition. At that transition period, some people may begin to have a cognitive problem called abstinence avoidance. They begin to feel guilty about their substance use disorder, about having to test it again. You know, they now lose hope. It means that to them they cannot do it. So they now progress to what we call full relapse. So that is actually the progression.
Okay. So is either it happens spontaneously,
yes,
or it happens.
And again, that transition stage can last for a few seconds, it can last for a few minutes, it can last for a few days. So when the person is still contemplating, battling with, do I continue or do I go back to abstinence level?
All right, Dr. Francis, how would you detect someone who is relapsing, who is undergoing that process, relapse?
Thank you very much. When one is undergoing the process of relapse, as I made mention earlier, that is re-emergence of symptoms, right? For instance, the individual functional state will be diminished in the sense that those things he or she normally do for himself or herself will no more be there. He will always need an assistance. For instance, when an individual is supposed to maintain good personal hygiene, all right, you observe that the individual is quite unkempt, not well groomed, and more so, when the person is supposed to go to work ordinarily, you see him staying at home and ask him, why didn't you go to work? He said, I've worked for over 3 months, have I been paid? Why must I go? All right, so
you find reasons to.
Yeah, you find reasons to. Or someone who's supposed to be in school, I asked him why, he said, for the past 2 weeks, the auntie has not been coming to school. Nothing's happening in the school. All right, and more so, some of these behaviors that are not inherent. For instance, an individual who always, indulge in the substance. You see the person, ask her, it's like you have taken substance in their hands. No. They just feel like taking tom-tom. They're not taking anything. But when you probe in depth, you observe that he has indulged into the substance. All right, again. So all these measures, and more so, there are indices through which you can use to measure relapse. For instance, high rate of hospitalization. When an individual is being admitted in a hospital, 3 times in less than 6 months, is a very good indices that the individual is relapsing more. The occurrence of relapse is high.
Okay, so when he starts doing things that he was doing when he was clearly dependent on drug before recovery, yes, it's a clear sign that he is relapsing.
Yeah, he is relapsing.
Okay, now I'm still with you. The symptoms now. For the individual, are there things the person will feel?
Yes, like, there are things the person will feel. You see, at times the individual may start having faulty perception, all right, or faulty cognitive thoughts. All right, someone who ordinarily every morning the person would greet you good morning, but when relapse comes, he wouldn't see the need to exchange the normal greetings with you. He will be seeing you as an enemy, seeing you as a threat, that you are the cause of his misfortune, that you always think bad, you always think evil against him, even when you know that you have never done. At times the individual may start responding to voices, strange voices, which ordinarily he has not been doing. All right, or he starts having a kind of poor thoughts, faulty thoughts, telling you that he has emerged the governor of the state, even when the governor of the state has been sworn in. He tells no, that one is false, that he's now the current governor of the state. You start seeing some sign of delusion of grandiosity, assuming what is not. So all these features, when you observe it, the individual, you're able to know that yes, something is going wrong.
It's all right. You've been joining us on Drug Danger showing on ETV channel 50. We will go on a momentary break and return after a while on the program. Stay with us. program Drug Dangers showing on ETV channel 50. And I still have in the house my guest from the Federal Neuropsychiatric Hospital, Enugu, Dr. Olisa Montfort Uche. He is a senior resident psychiatrist with the Federal Neuropsychiatric Hospital, Enugu. I also have Dr. Chinawa Francis, a clinical psychologist with the same hospital, taking us on the topic relapse. Dr. Olisa, are there mental implications of relapse?
Yes, there are mental implications of relapse. They're actually multiple. The person can have, if the person continues to use or maybe goes back to use a particular drug after a period of abstinence, then the person could have a multiplicity of mental problems like a depression. So there is a link between substance use and depression, especially when the person is withdrawing. Because at some point in time, when the person has started using the drug, the person may not be using the drug at that particular point in time. So the person starts having things like depression, because what the substance does is that it increases the level of pleasure hormones in the central nervous system. So when they are not using it, the person would go from a situation of high to a situation of low. Some other people may also have withdrawal symptoms like anxiety. When they stop using it, as after they've initiated it and something happens, they stop. Maybe they're not able to access it, they stop it. They become anxious, because of what we call dependence syndrome. They are already tolerant to it. So when they stop using the drug, because of the fact that the body is already used to it, the body will now start reacting. Right? Oh, you've been giving me this and you stopped it. So the body will start reacting. The person may be anxious, tremulous, and other things. Then of course there are a whole lot of other health complications, like liver damage, kidney damage in relation to substances like alcohol. So they're actually very, very much.
It's all right. Back with you, Dr. Francis. What can someone do after relapse has occurred?
Well, immediately after relapse has occurred, the best thing to do is to get the individual to the hospital, where multidisciplinary team will be able to attend to the individual, where the individual will receive expert treatment and a quick intervention will be addressed.
All right, you have something to add to that, Olisa. Is there hope really for someone struggling with drug who is on the path of recovery and has now relapsed?
Yes, there is hope, just like he has said. Just like I mentioned before, relapse is a major component of dependence syndrome. So when somebody has continued to use drug to a dependent level, it means that the person can no longer handle the situation himself. If it was just normal abuse, the person could have some control. But if it has reached dependence level that is characterized by relapse, it means that the person cannot help himself. The person has to be brought to the hospital, so that the person will be fully assessed. To know the things that are causing him to relapse, because there are several things that can cause somebody to relapse. And I mentioned previously that the person can actually have recurring mental conditions like depression, anxiety, psychosis, which may actually be pushing the person to relapse. So when the person is admitted, the person is assessed by a group of mental health professionals, psychiatrists, and so on and so forth, to detect where there are other associated conditions that are making the person to relapse. And if, for instance, you find out that the person has episodes of depression or has psychosis, we have drugs that we use in treating all those. Then again, there's something again that we call replacement therapy. For some people that are using some drugs like what we call opioids, they are highly addictive drugs and they have dangerous health consequences. So what we do is that we replace that opioid medication
with something less addictive.
Yes, something less addictive and something less harmful, and now gradually taper off. So these are some of the things that you cannot do at home. And again, the withdrawal I talked about, if somebody suddenly stops using a drug, maybe in an effort to be abstinent, the person may start having psychological symptoms, physiological symptoms like withdrawal, and at times some of these things can be life-threatening. So it's not something you can handle at home. So that's why when they come, we stop them from accessing the drugs, and we watch out for all those symptoms and we treat them.
Okay, your point is that anyone who is dependent on drug and needs help, or someone who is relapsing during
having
the
frequent relapse
should come to the hospital and should not handle it at home.
Yes.
And now when they come to the hospital, Dr. Francis, what is the role of the psychologist?
Yeah, thank you very much. The role of psychologist is quite enormous. It's quite unfortunate that the society at this level has not known the importance of psychologists.
Our society.
Yes, our society, has not known the importance of clinical psychologists as of this moment. Well, first and foremost, as a clinical psychologist, when the individual comes to the hospital, we have to assess him, take a comprehensive assessment using psychometric instruments to assess the individual as to know actually the cause of relapse, as he rightly made mention, because the cause of relapse may be enormous. At times, it could be as a result of high expressed emotions from families. All right, some families expressed their emotions so high that makes the individual to relapse, such as parents or some families will tell you that since you were born, we are not useful to this family. All what you are good is just, causing me a high level of expenses, leading me to poverty and all that. They have tarnished the image of this family. This family is not noted for substance use and all that. And at the end of the day, the high expressed emotion may make the individual to continue to indulge in substances. And as a clinical psychologist, we're going to institute what we call motivational interview. Motivational interview is a kind of treatment whereby we try to measure the desire of that individual to effect a change. Because a motivational interview, it has about 6 stages. You'll be able to know actually if this individual is at the pre-contemplation stage. Is there in denial that he has not been indulging in the substance? Does he want to change? While the contemplation stage is the stage of ambivalence, just as he rightly said. Do I stop this drug? Do I continue? And the stage of ambivalence, is a mixed feelings, which ordinarily some of them don't find it easy to dissociate themselves from the substance because of the pleasure they usually get from their peers. If I stop taking these substances, I will not be meeting my peers at the joint where we take it, and if I stop taking it, they will see me as a downfall. So this motivational interview, when it is being carried out as a clinical psychologist, it would now help us to educate the client to recognize and actually avoid those cravings. Because motivational interview will give us a clue to know actually where the trigger comes most. Is it from the internal generated environment? Is it external environment? And when it does, we'll be able to know the kind of therapy to institute. All right, there are so many therapy which you will institute for drug dependent person, and some of them is what we call drug refusal therapy. It's a kind of therapy that has about 8 sessions. You teach the person how he will be able to dictate the craving, and when the craving comes, this is what you will do. If you do it, the craving will stop. You teach the person how to dissociate the thoughts. All right, there are some destructive thoughts that will come and say, why are you still here? Why not go and meet them at the joint? This is the time for you to be at the joint. So you educate individual that when this thought comes, this is actually what you have to do. And when the person keeps doing it, the thought will cease to come. So we call it drug refusal therapy. Okay, in fact, it's not what I'm going to enumerate. They are numerous, and in the course of passing through these sessions, the individual will be able to cope, will be able to avoid the use of substances ordinarily on his own, and by so doing, relapse will not be imminent.
Okay, so in summary, a combination of psychiatric and psychological intervention is required for management of relapse.
Exactly.
All right, go ahead.
So there is another, ideally, when you're managing any form of mental illness, whether psychological or whatever, there is something we call biopsychosocial model. The biological aspect of it is one I talked about, use of replacement therapy and treatment of other comorbid medical conditions. Then he talked about the psychology. There is also the social component of it. Just like he mentioned, there's something we call high expressed emotion. These are negative attributes of the patient's family or the person that uses the drug. Some of them become critical. They tell them bad things. They tell them they are nobodies. They're actually contributing to that relapse. So we use social workers. We also have social workers that we send to their families to find out the dynamics in the family. Is it really the family of this patient that is causing him to relapse? So that is it. Then again, occupational therapy is also very important, because some of these people, they do not know how to retain jobs. If you take history from them, you find out that they jump from one job to the other, and they don't know how to hold jobs and all those. Or maybe the job involved in is actually a trigger factor. Maybe somebody that uses substances being involved in a bad business. So of course we have to encourage the person to desist from it. So it's actually a whole lot of things.
All right, thank you very much, Dr. Montfort Olisa. He is a senior resident psychiatrist with the Federal Neuropsychiatrist Hospital in Enugu. Many thanks for being here again on Drug Dangers. I also have in the house Dr. Chinawa Francis. He is a clinical psychologist also with the Federal Neuropsychiatric Hospital in Enugu. Thanks for coming.
Thank you.
The topic of discussion today was relapse. Recovering from drug dependence doesn't always go as planned. The sobriety path comes with several challenges, and also the journey to total recovery include a period of relapse. Relapse is a dangerous, though normal phase of recovery. But the good news is that with hard work and positive attitude, you can avoid this, and you can also overcome it. In all, stay out of drugs. My name is Ngozika Mba on the program Drug Dangers. My producer has been Nkechi Nyerem. Many thanks to the production team. Thanks for watching us.